Hey there, Duluth moms. Thanks for tuning in tonight for our expert panel discussion. We have three expert health professionals from St. Luke's here tonight. Normally at Bloom, we have the panels all in front of you moms, and you're able to ask your questions in person and have a back and forth discussion with the health professionals. But due to the virtual event, we had moms pre-submit questions to ask. So we will be going through those tonight. And then if you do have any further questions, you can type them in the comments below, and we will try to get back to you with that. And also, if you interact and ask questions, make comments tonight, you'll be entered into the giveaway that we have with this video. So tonight we'll be chatting about all things relating to pediatrics, lactation, pelvic floor health, and maternal and child nutrition. So let's bring in the experts. Hello.
Hi.
Hey. Thanks for being here to talk to our moms. Would you each like to introduce yourselves? Brenda, would you start?
Sure. I'm Brenda. I'm a registered dietitian here at St. Luke's. And I see a lot of different patients, but here at St. Luke's, I see most pediatric patients. I see babies, toddlers, school-aged children, all the way up through teenagers. And then sometimes we do see moms too during their pregnancy as well, if they have any nutrition-related questions.
Awesome.
Hi, I'm Dr. Amanda Webb. I'm a pediatrician here at St. Luke's. I've been in the Duluth area practicing for about 10 years. And in the last 7, I'm also a certified lactation counselor. Just knowing that breastfeeding issues extend past that newborn period when you're getting so much help with the lactation nurses in the hospital.
Yeah, great. And I know a lot of the questions that relate to lactation also relate to the diet of the mom and sometimes the babies, depending on their gestational issues. So a few of the questions will relate to both of you, so you can both answer if you'd like. One of the first questions that we had from a mom was, when do you know if you should ask for lactation help?
I guess the question should be you should always be asking for help. We know that, the more hands-on and expertise kind of help you get from the beginning, it just makes the moms a confident nurser. And I feel like, anytime that maybe breastfeeding hasn't gone so well, it's, unfortunately just because they haven't had access to getting frequent and early help. Mm-hmm. So, every baby born at St. Luke's will have several visits with the lactation nurse and the rest of the nursing staff, for that matter, that all have breastfeeding training right as soon as their baby's born. And then we encourage those moms to bring the baby back even just 2 days after the delivery for another 1 full hour session with the lactation nurse to kind of keep working on getting it successful at the beginning. And then if there are any issues, follow-up appointments are usually created with sometimes the mom and baby going back to that lactation nurse once or twice a week.
Yeah, I know a lot of people just think it's natural, so it's going to be easy. And it's not. It takes a lot of confidence so the baby doesn't feel the stress and have issues. Mm-hmm. I know that's.
Yeah.
I learned that. Let's see. We have a couple questions relating to signs of mastitis or a clogged duct, and then also if you have any suggestions on how to boost your supply.
Sure. Usually engorgement, clogged duct, and mastitis kind of run the spectrum of breast symptoms that moms will experience, with probably being engorged leading to the clogged duct, which could then lead on to an actual infection. The bottom line is they all really hurt. So if you're having a lot of pain in your breast, And especially if you feel something lumpy or hard, that should mean that you should be calling the birthing center or your doctor right away just to see. If you're experiencing flu-like symptoms, fever, chills, that's usually a signal of at least clogged duct and even mastitis. So you definitely should be calling at that point. But first things to try at home are usually getting in the shower and doing some hand expression to try to get that milk flowing again. You can try to pump or have the baby nurse as well, but sometimes that's really painful. So usually trying to get the hand expression going first and then making sure you're talking back with the lactation nurse or your doctor.
So it's my understanding that if you do actually have mastitis and not just a clogged duct, that it needs to be treated with medication. Is that correct?
Not necessarily. And again, this might be going a little bit outside my realm since I'm not taking care of the moms specifically as my patients, but many women can have fever and chills that last briefly and not need to be on antibiotics. So again, it's going to be calling probably your OB or the delivering doctor again, but a lot of times we rush right to antibiotics, and that is not always needed.
Mm-hmm. Yeah, that's great to know too. Now, if you're not engorged and you would like to increase your supply, do either of you have suggestions for the mom's diet, nutrition, anything they can do? Relax, I guess, would be one.
Yeah.
Yeah.
Maybe Brenda can speak to some of the dietary things.
Yeah.
Well, for moms to keep in mind that you get to have more calories when you're breastfeeding than you do when you're pregnant. So just making sure that you're keeping up with your nutrition and that you're getting an adequate amount through the day is important. Dr. Webb is demonstrating, making sure you're well hydrated as well is important. There's a lot of those kind of old wives' tales about certain foods that can help increase supply. And there's a tiny bit of science behind it, but it's there isn't a magical food that's suddenly going to increase your supply. So really it's just making sure that you're getting an adequate nutrition and adequate fluids through the day.
Yeah, that's great.
And I would add, I would just add that it's most of your milk supply is a supply and demand. Mm-hmm. So the more that you're demanding your body to make milk via either the infant nursing or pumping is really the best way to bring it up. And in some cases, the baby's got a great latch, mom's pumping all the time, and we're still not getting enough milk supply to keep that baby growing, which is probably the most frustrating scenario I think most moms run into. And there are some medications, usually not prescribed by me because, again, I'm not the physician for the doctor or for the mom, but there are some medications that have been shown to help a little bit. But again, it's really working back again with that latch and getting that baby to get the milk out and then getting your body to respond by making more.
And I think one of the phrases that we hear a lot in motherhood is fed is best. So if you are frustrated and you feel like your child is not growing or is hungry, would you encourage the mom to reach out to her doctor and the child's doctor, or what route would a mom go to see if she needs a supplement with formula?
Yeah, generally, for babies that I'm evaluating with slow weight gain, the mom's usually been working with the lactation nurse to kind of try all the things needed to get enough milk, if that's nursing, if it's pumping and bottle feeding. And, as long as your baby's healthy, not dehydrated, and, everybody kind of has the impression that eventually the mom's gonna be able to make enough milk. We don't need to rush to using formula. And I usually let the mom guide me on that. If she's, really distraught over the idea of using formula and I don't deem that it's necessary, then, we give her some leeway on that and, just try to encourage her to keep up with what's working and follow the baby closely with weight checks. But on the flip side, if the mom's totally exhausted by this breastfeeding plan and she just wants to see her baby satisfied, then absolutely, we'll get, it's almost like they feel like they need permission to add it. And it's okay, because like you said, a fed baby is a really happy baby.
Mm-hmm. Yeah. It makes all areas of life a lot easier.
Yeah.
Happy.
Yeah.
Another question that we had, this one is, I would believe aimed for Brenda, would be, there's a lot of talk about intermittent fasting right now. It seems to be one of the diet trends. And a mom is wondering if that's healthy for women of childbearing age to be participating in.
Sure. Well, I mean, we could spend hours talking about intermittent fasting. I think first, what we have to do is define what they mean by intermittent fasting, because there are so many different intermittent fasting diets out there. Some of them just mean that you don't eat after like 9 o'clock at night. Or there are some that are as extreme as you're eating one day and then not eating for another day. So kind of asking that mom what they are looking for, number one. That's what I'm always asking my patients, like what do you want to achieve by doing this diet? What their schedule is like. Do they have a schedule that would work well with an intermittent fasting type diet? And their medical history. There are some conditions that I would not recommend that for. Normally pregnancy would be one of them at the top of that list. And lactation as well, just because we want to make sure, again, you need those extra calories when you're breastfeeding. So making sure that you're keeping up your nutrition to keep your milk supply up.
Yeah, that's great. So I think most of the answers stem back to make sure you're communicating with your doctor.
Right. Yep. Exactly.
Yeah, that's great. Awesome. Well, I think the next question, you touched on this a little bit with growth, but if a mom is concerned about her baby or child not meeting the milestones that they feel they should be at, can you speak to that, what a mom should do?
Sure. So, a lot of times we don't want to have the parents left wondering if their baby's growing and developing normally, and that's probably the basis for why we see young infants and toddlers so frequently, just for regular checkups to kind of assess their development, every 2 to 3 months in the first year, and then every 3 to 6 months in the second and third year. And probably the thing that's most important to kind of help parents learn is that there's going to be a big variety of what's normal. Especially if parents are comparing their children to their own children when they were at certain ages, or even to their friends and family's children. My friend's daughter is only 3 weeks older, but she says 20 more words than my kid. So kind of just like establishing that there's going to be a wide variety of still what's normal. And if we do find that there's maybe some areas that need to be worked on, we know early intervention will be the best to help get that kid right back on track. And one of the best things that we utilize is the early intervention through schools, which is a program called Help Me Grow, where some early childhood therapists, including usually speech and physical therapists, actually come to your home to evaluate your child. If you bring your child to the clinic, you're going to know that your kid doesn't like being there. It's a new environment. It's fearful. They usually get shots. The kid knows that. So it's really hard sometimes to assess what's going on. But if you have the assessment done in the natural environment of your child, they're more likely to show the therapist exactly what they're capable of. And then from there, if there's need, we can get them plugged right in with whatever services they might need. And Help Me Grow is great too, because you don't need to come to us first. If you have concerns, parents can call directly there if they're ever worried and say, hey, I don't think my kid's saying enough words. They can initiate that assessment themselves.
Cool. That's great to know. You mentioned bringing the children and the babies into the clinic. I know healthcare looks a little bit different right now with COVID. Yep. There is a new mom who is hesitant to bring her child, her baby, a new freshborn baby, into the hospital. What do you suggest that she should know to feel more confident if she needs to go in, or how she should know if she can do a virtual call?
Yeah. So, I think across all the local hospitals and clinics, everyone's taken great steps to help assure that, our safety and their safety is, the most important thing. And so everyone's wearing a mask, and all the providers wear kind of like a face shield or goggles to really just help keep everybody safe. In terms of the newest of babies, they're a little bit even better protected, because they're usually brought in, in their car seat or in a stroller, so they can just like physically be covered as you kind of walk through the more busy areas of the elevator and the waiting room and things like that. With really, COVID is a tricky thing because it's ever evolving, and we're trying to keep up with the science and do the science as quick as we can. But, we know the highest chance for exposure is the longer you're in a closed space without wearing a mask or a covering. So, if you think about a typical clinic visit, it's pretty brief. And if everybody's kind of protecting the where their respiratory stuff is going, then your kids will be safe. And we're certainly trying our best to do as many things virtually or with a video appointment as we can. But a lot of times we need to see the kid, we need to weigh them, we need to see what that rash is all about, we need to look in the ears. And I find that you're certainly going to be better off having us check that out, and rather than being left wondering what could be wrong, why your kid's fussy, stuff like that.
Yeah, that's true. Awesome. Well, the next few questions relate to the diets of the kids. So maybe when you feel that your breastfeeding journey is coming to an end, or your child is needing a little bit more than formula, or showing signs of being ready to start experimenting, exploring with finger foods, what should the nutrition of a child look like? What should their plate look like? When is a good age to start, or what signs should you start to look for to see if your child's ready to start with normal food?
Sure. Well, we normally don't give a specific age of when to start. So recommendations are anywhere from 4 to 6 months, but maybe even later than that. What we look for is to make sure that they can sit up, that they hold their head up, that they turn their head side to side, that they stick their tongue out, that they're interested in food. Those are the signs that we look for, instead of saying, oh, exactly at 4 months you have to start doing this and that. So it's more developmental stages instead of a specific age. There's a lot of mixed science on what you're supposed to start with. Honestly, I recommend like fruits and veggies, soft cooked fruits and veggies above other foods. Personal experience. I know we're not supposed to talk personal experience, right? We're professional science providers here, but I had one baby that absolutely loved pureed food, and then my 8-month-old right now doesn't eat pureed food at all. But anything we give her, she loves from our plate. And science-wise, that is what we should be doing. We should be feeding our kids what we're eating. So having those soft, really tiny bite-sized options for them to try is ideal. Also keeping in mind that breast milk or formula is their main source of nutrition up until a year of age. So those other foods we say foods are for fun up until a year. So they're exploring different flavors and textures. So you want to give them a variety of the flavors and textures to play with it and explore.
Mm-hmm. Yeah. Would you say that is the best way to start to introduce and develop a healthy eating habit? Would be to model that example and let them eat what you're eating?
Absolutely. Yeah.
And I would agree with everything Brenda said. Every child's different in terms of what kind of flavors and textures appeal to them. Certainly starting when that child looks ready is the best place to go. You don't want to force feed your kid. You don't want or need to give them foods that they're not going to like and keep forcing it. I usually tell families to start with something that probably looks and tastes good so that when they first eat, they get that enjoyment of it and want to keep trying. And that goes with, if you're going to kind of follow a pureed approach with advancing textures, or if you want to just start right away with more of those bite-sized pieces. And I find that the kids kind of are foolproof. They're going to eat what they're going to eat, and it's not necessarily how the parents are intervening. It's just whatever that kid's ability is to eat is. And I will add just a little bit about food allergies, because a lot of basically all the food allergy research is showing us that if we give likely allergenic foods early, that will actually prevent food allergies. So, which is basically a complete reversal of what we were saying. I think when I started practice, we said don't give peanut butter till your child is 3. And now it says we can start it as early as 4 months. And actually kids that are at higher risk for food allergies, or those babies with eczema, it says, give it to them early so that we can prevent allergies. So that's going to include peanut butter and fish, shellfish, eggs, and you just basically start those when your kid's ready to handle that texture. Peanut butter is one of the earliest, because if your child's using a pureed texture, that can easily be swirled in just with whatever they like to eat already. And what you're looking for is rash. And it's not going to be a rash that comes 3 or 4 days later. It's going to be hives or blotchiness within that first half hour of eating, and it should be pretty obvious if there's a reaction. At that point, you don't do it again, and you give the doctor a call.
Mm-hmm. Yeah, that's great. I was one of those kids that was allergic to strawberries. It was a strange food, and then I outgrew it, thankfully.
Yes, thankfully, yeah.
I would get a rash when I was younger when I had strawberries. Yeah.
Yeah, there are quite a few kind of specialty items now out on the market that if you are worried about allergies, it's kind of special powders that contain some of the major proteins of the allergens. But that's really not necessary. Like Dr. Webb said, taking some peanut butter and kind of swirling it through a puree, or, fish is something that's really soft that they can eat early on. So while those things might be interesting, especially if you have a strong family history of allergies, or if you've seen signs of some food allergies in your infant, looking into some of those products, but normally you can just try with real food.
Awesome. And then honey is a different one. That's not an allergen. It would be the botulism in it, correct? So is there still a time suggested to introduce honey?
Correct.
Yes.
Yeah. Okay. And what age?
So 1 year. So the issue is it's not an allergy. It's if your honey is contaminated with botulism toxin, which is still really rare to actually have the contamination. It's that the infant gut can't safely process that toxin until about a year. And at which point we think the gut's developed. And, if you were to happen to be exposed to contaminated honey, then you would be fine. So that's really the only thing you can't eat still.
Okay. Nice. I think we've touched on all of the questions that the moms have submitted. Do either of you have anything else to add that you feel moms should know?
Yeah, actually this kind of would be a question for Brenda, because I feel like I get a lot of it. Fussy baby, mom's worried about something in her diet. It tends to be a pretty big question around, anywhere from 6 weeks, or sorry, maybe even earlier, a month of age up to 2 or 3 months of age. Is something the mom's eating creating the fussiness in her child? And usually not. And I hate to see moms take everything out of their diet, especially if, they're already not sleeping from their, baby that's having a hard time. And I generally explain that colic is a normal developmental phase that's not generally associated with digestive issues, although it can be. And if I do recommend anything in terms of dietary restrictions for mom, it's removal of dairy and soy proteins, because those have been shown to cause some issues. But maybe you can talk about how you guide them through that, because
so yeah, that's a really great answer, and that's exactly what I would do too. I hear a lot of moms now eliminating quite a few things from their diet, and it's already a stressful and kind of hectic time. You don't want to make things harder for yourself than it needs to be. And just remembering that it is somewhat of a normal developmental kind of period for little ones. They're learning how to live on the outside, and their stomach is learning how to digest new things. So yes, dairy and soy are the two that are most likely to cause issues with little ones' digestive tracts. But normally, sometimes even just reducing, if you are like consuming large amounts of dairy and soy, trying to reduce that a little bit. But most of the time, it's just a phase that likely, hopefully, they will outgrow. Not always, but sometimes. And yeah, I hate to see moms strip all of their diet of all these different things when it's not really necessary.
Yeah, and kind of mom guilt, so baby's doing great, mom has a slice of pizza and correlates that maybe to a little bit more of a fussy baby, and she's like, I should have had the pizza, and I'm like, oh, just have the pizza, and the wine or the coffee or whatever, like
Yeah.
all good.
Yeah.
So that's when you asked if there was anything else to say, it's kind of just allowing yourself to have those things afterwards, and kind of stocking up on more of those convenience type items. Actually, there's lots of really helpful convenience type foods that you can have. So of course, fresh fruits and veggies, just making them easy and accessible to grab. But things like nuts or cereals or canned beans that are easy to just throw into a dinner. So quick and easy items, and not feeling guilty, right, about the occasional pizza or coffee or glass of wine as well. They can all fit at that time.
Yeah, that's great. I know the mom guilt is huge, and that adds stress, and that doesn't help your child's attitude either. So,
No.
Yeah. Having those little simple enjoyments to take care of the mom's, I guess, emotional, mental health too.
Absolutely.
Yeah. Right. Well, if there is a mom who does not have established care yet for, let's say, their infant or toddler, or if they would like more dietary advice, how can they establish care with either of you or at St. Luke's? And do you need referrals?
You do need a referral to see a dietitian, and that can either come from a pediatrician, your primary care, your OB. You can also just call our office directly, and we can kind of message the physician with your concerns and get that referral that way as well. So whatever is kind of easiest for you to see us.
Kind of the same thing. You don't need a referral to see a pediatrician. We both operate as primary care and sometimes a little bit of a specialty service. So if you're seeing a family medicine provider and sometimes they have questions about growth and nutrition, usually that doctor will call one of us directly just to see if there's anything additional that needs to be done. If it's, an exam, some lab work, seeing the dietitian, things like that. But, if any time would want to establish with one of us kind of moving forward is, just calling and asking for the appointment.
Okay, great. And are both of you taking new patients?
Yep.
Yeah, okay. Awesome. Well, thank you so much for spending time with us today and sharing your time and your expertise with the moms here in Duluth. And thank you for all that you do in the community.
Thank you.
You're welcome.
Thank you so much.
Thanks for having us.
Yeah. Bye.
Bye-bye.